What is the brain and why is it so important? Brain hemorrhage, brain aneurysm, and stroke. Everything you need to know to protect your brain. Today we're going to talk about 3 serious neurological conditions that affect millions of people around the world. Brain hemorrhage, brain aneurysm, and stroke. Before we begin, don't forget to subscribe to the channel and leave a comment saying Integrati Medicine/Soledad del Prado. Many people believe these are the same condition, but they are actually different medical emergencies, although they are closely related. Understanding what they are, why they happen, what symptoms they cause, and how to prevent them can literally make the difference between life and death. Stay until the end, because you'll learn the warning signs you should never ignore. What is the brain? The brain is the most complex organ in the human body. It weighs approximately 1.4 kilograms, 3 pounds, and contains around 0.86 billion neurons. It controls memory, movement, breathing, language, emotions, thinking, vision, balance, heart rate. Although it represents only about 2% of our body weight, it consumes nearly 20% of all the oxygen and energy used by the body. That's why it requires a constant blood supply. When that blood supply is interrupted or bleeding occurs inside the brain cells begin to die within minutes. What is a stroke? The word stroke refers to a sudden interruption of blood flow to the brain, often described as a brain attack. It occurs when part of the brain no longer receives enough blood. Without oxygen and nutrients, brain cells begin to die very quickly. There are 2 main types of stroke. Ischemic stroke. This is the most common type. It occurs when a brain artery becomes blocked by a blood clot. As a result, blood cannot reach part of the brain, causing brain cells to die from lack of oxygen. Hemorrhagic stroke. This occurs when a blood vessel inside the brain ruptures and starts bleeding. The leaked blood damages brain tissue directly, while also increasing pressure inside the skull. What is a brain hemorrhage? A brain hemorrhage occurs when blood leaks from a ruptured blood vessel into or around the brain. When blood enters areas where it shouldn't be, it compresses brain tissue, increases intracranial pressure, prevents oxygen from reaching brain cells, destroys neurons. Permanent brain damage can occur within minutes. What is a brain aneurysm? A brain aneurysm is a weakened area in the wall of an artery that balloons outward. Imagine the inner tube of a bicycle tire. If one section becomes weak, it bulges outward. The same thing happens in a weakened brain artery. Many aneurysms remain silent for years without causing symptoms. The real danger begins when they rupture. A ruptured aneurysm can cause a massive brain hemorrhage that may be life-threatening. Why does a stroke happen? The main causes include high blood pressure, high cholesterol, diabetes, obesity, smoking, physical inactivity, heart rhythm disorders, arrhythmias, blood vessel diseases, excessive alcohol consumption. Why does a brain hemorrhage occur? The most common causes are high blood pressure. This is the leading cause. Constant high blood pressure gradually weakens artery walls until they rupture. Head injuries, traffic accidents, falls or severe blows to the head. Ruptured brain aneurysms. One of the most dangerous causes, vascular malformations, congenital abnormalities affecting arteries and veins in the brain. Blood-thinning medications, anticoagulants can increase the risk of bleeding. Why do brain aneurysms develop? The main risk factors include high blood pressure, smoking, family history, age over 40, certain genetic disorders, congenital weakness of artery walls, which organs are affected. Although the primary damage occurs in the brain, its effects can involve the entire body. Depending on the area of the brain affected, the following may be involved: eyes, double vision, partial or complete vision loss, heart, irregular heartbeat, lungs, breathing difficulties, muscles, paralysis, muscle weakness, digestive system, difficulty swallowing, nervous system, memory problems, emotional changes, cognitive impairment, stroke symptoms. Stroke symptoms usually appear suddenly. These include weakness on one side of the body, facial drooping, difficulty speaking, confusion, vision, loss, dizziness, difficulty walking, loss of balance, symptoms of a brain hemorrhage, sudden severe headache, nausea, vomiting, seizures, drowsiness, loss of consciousness, weakness in the arms or legs, speech difficulties. Symptoms of a brain aneurysm. If the aneurysm has not ruptured, it may produce no symptoms at all. However, it can sometimes cause pain behind one eye, double vision, a dilated pupil, facial numbness or tingling. If the aneurysm ruptures, it causes a sudden explosive headache. Many patients describe it as the worst headache of my life. Other symptoms may include nausea, stiff neck seizures, loss of consciousness, coma, long-term effects and complications, after a stroke, paralysis, memory problems, difficulty speaking, emotional disorders, depression, anxiety, balance problems, after a brain hemorrhage, permanent brain damage, seizures, cognitive impairment, physical disability, coma, death in severe cases, after a ruptured brain aneurysm, severe neurological damage, memory loss, speech difficulties, movement disorders, coma, death. Can these conditions be prevented? In many cases, yes. The most important preventive measures are: keep your blood pressure under control, don't smoke, maintain a healthy weight, exercise regularly, control diabetes, limit alcohol consumption, keep cholesterol levels under control, get enough sleep, reduce chronic stress. Conclusion: brain hemorrhage, brain aneurysm, and stroke are medical emergencies that can change a person's life within minutes. An aneurysm is a weakened area in an artery. A brain hemorrhage is bleeding caused by the rupture of a blood vessel. A stroke is brain damage caused by an interruption or alteration of blood flow to the brain. Recognizing the warning signs early can save lives and reduce the risk of permanent disability. If you found this video helpful, subscribe to the channel, share this video, and leave the word brain in the comments so I know you've watched until the end. Thank you for watching. See you in the next video.